In recent years, the world has become increasingly aware of emerging and re-emerging pathogens, a trend largely catalyzed by the global pandemic caused by SARS-CoV-2, the virus responsible for COVID-19. However, the increased vigilance has also led to heightened concern over other viruses, sometimes unwarrantedly. One such virus currently under the spotlight is the Human Metapneumovirus, HMPV. Although HMPV is a significant respiratory pathogen, it is not the new COVID-19. Understanding the differences in their biology, epidemiology, and public health impact is critical to prevent misinformation and panic while ensuring appropriate measures are taken to address each virus. Understanding HMPV, an overview discovered in 2001, Human Metapneumovirus, HMPV, belongs to the Pneumoviridae family, closely related to respiratory syncytial virus, RSV. It primarily affects the respiratory system, and is a common cause of respiratory illness in children, the elderly, and immunocompromised individuals. The virus typically circulates during the late winter and early spring, coinciding with other seasonal respiratory viruses such as influenza and RSV. HMPV spreads through respiratory droplets, direct contact, and contaminated surfaces, much like other respiratory viruses. Symptoms of HMPV infection range from mild cold-like symptoms, such as cough, fever, nasal congestion, and sore throat, to more severe manifestations like bronchiolitis and pneumonia. Severe cases are more likely in infants under the age of 5, older adults over 65, and individuals with underlying health conditions. Despite its clinical significance, HMPV often goes undiagnosed because its symptoms overlap with those of other respiratory viruses, and routine diagnostic tests for HMPV are not widely available outside of research or specialized clinical settings. HMPV versus COVID-19, key differences to compare HMPV with COVID-19 effectively. It is essential to consider differences in several key areas. Causative agent and genetic makeup. HMPV is a single-stranded RNA virus from the Pneumoviridae family, whereas SARS-CoV-2 is a single-stranded RNA virus from the Coronaviridae family. Their genetic makeup and evolutionary history differ significantly, affecting how they interact with human hosts. Epidemiology. HMPV has been circulating globally for decades, with most individuals exposed to the virus by early childhood. SARS-CoV-2, on the other hand, was a novel pathogen when it emerged in late 2019, leading to widespread susceptibility in the global population. HMPV's seasonal pattern contrasts with the initially unpredictable and widespread transmission of SARS-CoV-2. Transmission and infectivity. While both viruses spread via respiratory droplets, SARS-CoV-2 is far more contagious. Its basic reproduction number, R0, during the early pandemic was estimated between 2 and 3, significantly higher than that of HMPV. SARS-CoV-2's potential for asymptomatic transmission and prolonged viral shedding made it uniquely challenging to control. Disease severity and mortality. Although HMPV can cause severe illness, especially in vulnerable populations, its overall case fatality rate is substantially lower than that of COVID-19 during the early pandemic stages. SARS-CoV-2's ability to cause severe systemic inflammation, multi-organ failure, and long-term complications, commonly referred to as long COVID, sets it apart. Global impact. COVID-19 caused a global health crisis, overwhelming healthcare systems, disrupting economies, and reshaping societal norms. HMPV, while clinically significant, has never reached this scale of impact. Public health response. The global response to COVID-19 included unprecedented measures, nationwide lockdowns, travel restrictions, mass vaccination campaigns, and extensive public health communication. These actions were necessary due to the high transmissibility, severity, and novelty of SARS-CoV-2. In contrast, public health measures for HMPV are more aligned with those for managing seasonal respiratory viruses. Currently, there are no vaccines or specific antiviral treatments for HMPV. Supportive care, such as oxygen therapy for severe cases, remains the mainstay of treatment. Efforts to prevent HMPV focus on standard infection control practices, including hand hygiene, respiratory etiquette, and isolating symptomatic individuals. While these measures are crucial, the absence of a vaccine and targeted treatments underscores the need for further research. Why HMPV is garnering attention? The recent spotlight on HMPV can be attributed to several factors. Post-COVID-19 vigilance. The COVID-19 pandemic heightened awareness of respiratory viruses, leading to increased testing and surveillance. As a result, HMPV and other previously underrecognized pathogens are now being detected more frequently. Overlapping symptoms. The symptoms of HMPV overlap with those of COVID-19, RSV, and influenza, making differential diagnosis more challenging. In the post-pandemic context, any respiratory virus causing outbreaks can attract significant attention. Healthcare system strain. Seasonal surges of HMPV contribute to the strain on healthcare systems already burdened by other respiratory viruses. This has been especially evident during the so-called tripledemic of RSV, influenza, and COVID-19. Lessons learned from COVID-19. The COVID-19 pandemic offers valuable lessons that can be applied to managing HMPV and similar viruses. Improved surveillance. Enhanced global surveillance systems for respiratory pathogens can help monitor HMPV's prevalence, identify outbreaks, and guide public health responses. Diagnostics and research. The development and deployment of rapid diagnostic tools for HMPV can improve patient outcomes and inform infection control measures. Increased research funding can accelerate the development of vaccines and antiviral therapies for HMPV. Public health communication. Clear, evidence-based communication is vital to prevent misinformation and public panic. Differentiating between pathogens like HMPV and SARS-CoV-2 can help set realistic expectations. Healthcare preparedness. Strengthening healthcare infrastructure to manage seasonal respiratory virus surges is essential. Lessons from COVID-19, such as increasing ICU capacity and stockpiling medical supplies, remain relevant. Addressing misinformation. Comparing HMPV to COVID-19 without context can lead to unnecessary alarm. While both viruses are important, they differ vastly in their epidemiology, transmissibility, and impact. Public health officials and the media have a responsibility to provide accurate information, emphasizing that HMPV, though significant, does not pose the same level of threat as COVID-19. Conclusion. HMPV is a clinically important respiratory virus, particularly for vulnerable populations. However, it is not the new COVID-19. Understanding the distinctions between these pathogens is crucial for guiding public health responses and resource allocation. By applying lessons learned from the COVID-19 pandemic, we can better manage HMPV and other respiratory viruses, ensuring a balanced approach that prioritizes both preparedness and proportionate response. The goal is not to minimize the importance of HMPV, but to contextualize it within the broader landscape of respiratory viruses, avoiding unnecessary panic while promoting effective prevention and management strategies. Subscribe, like, share and comments for the latest news about HMPV.